I hope you can hear me. All right. I'm trying to go live simultaneously on more than one platforms. All right. So the thing with Instagram is Instagram can't connect. Instagram can't connect like the other one them connect. So that's the downside of Instagram. Instagram doesn't allow me to connect through the restreamer. All right. So I'm using my phone on Instagram and I'm using my computer for Facebook and YouTube. I'm doing everything simultaneously. So let me just address you people on Instagram. I see 7 of you. What I'm doing today, I put up the poster before. We're starting some talks about the COVID-19, just to allow people to understand what it is, right? And what a lot of misinformation is going on, and we need people to understand the entire disease process. All right, so basically I see people joining me now on YouTube and Facebook, so let me bring up. Hi, hello everybody. All right, so as you would have seen, I want to start these talks where I continue to educate you about what's going on. All right? Unable to connect. Okay. I'm not seeing, I don't know what's going on with YouTube, but I soon saw that out. But yeah, so basically the purpose of these talks is to educate you. Today we want to look at why it is important to stop smoking. All right, so let me take a minute to share up the live over there on Facebook. YouTube, if you are up and running, I'm gonna ask you to share it up, like and share, get everybody on board. Hi Face, I see a lot of people on Facebook. All right, so share. I just want to take the opportunity to share it. All right, please share it up. Everybody share it up so that I can get the audience. All right. So unfortunately for those of you on Instagram, you won't be able to see some of the graphics that I'm putting up because, as I say, it's on the interface on my computer. All right, but what I do want to tell you from now is that it's very important for you to stop smoking, no matter what you smoke. People have this general misconception that it's okay to smoke weed or it's okay to vape, it's okay to do whatever. Some people, not a lot of Jamaicans smoke just plain cigarettes. We tend to smoke weed. There is a growing culture of vaping right now. That's definitely not healthy. And smoking is smoking is smoking is smoking where the disease is concerned. I want you to believe me on that. All right? So let me see what's going on with YouTube, because YouTube wasn't coming up before. Anybody who is watching me on YouTube, I am unable to see your comments. All right? But just know that I love you same way. All right? No, I just want to start by showing you about the disease, telling you about the disease. What may I go do for you people over here on IG. I'm gonna turn around the camera so you can see the screen. All right, this is what I'm showing them. All right, so basically with coronavirus, the virus which is called the SARS-CoV-2 virus. That's what the virus is called. SARS-CoV-2 virus is the name of the virus. It causes the disease COVID-19. So the virus is SARS-CoV-2. The disease is COVID-19, kind of like HIV and AIDS. HIV is the virus that causes AIDS, the disease. You understand what I'm saying? All right. So what the virus does, this virus spreads by droplet. Some people are now saying it's aerosolized, meaning that it can travel through the air for quite a while. All right. So when the virus goes on your hand, the hand of somebody who is infected, when they try to cover them out, when them cough or sneeze, or if they touch a surface, it can live on some surfaces for as long as 9 days, by the way. All right. So if it's on a surface, it's transferred when somebody touches that surface and puts it in their mouth or in them nose, in them face, even the eyes, right? So if you touch a dirty surface, an infected surface, let me try to fix back that something here. If you touch an infected surface, when you put your hand to your face after you touch the surface, that is how you get it. You understand what I'm saying? So when you put your hand in your face, the virus comes off and it goes through your nose or your mouth, and it ends up going all the way down to your lungs. The reason why it doesn't attach to the lungs, or it doesn't attach to the throat or any of the cells down here, is because viruses have a specific, basically like a key. It's like viruses use a lock and key thing. All cells do that, right? You have to have a specific type. Basically, you know how it stays with all of those poles. At the end of that pole, it has a specific molecule, right, that has to attach to a receptor in a specific cell. All right. So if you look back on what I was showing you, that is the virus there that looked green, and it actually goes down to the lungs where it attaches to a specific cell in the lungs called the pneumocytes. All right, and they have receptors on them called the ACE2 receptors, right? The angiotensin converting enzyme receptor. Now, we don't really need to go into the technicality of it, but just so you know, the virus attacks those lung cells called the pneumocytes that specifically have the ACE2 receptors on them, right? And we've spoken about this on numerous occasions. Now, the problem now when you smoke is that, and this is, I want you to bear in mind, this is not just cigarette smoke. As I said, this is any kind of smoke. If you were constantly in an environment, like, I could talk about Riverton. If you were constantly in an area where you're exposed to smoke from like the dump when it's on fire, basically it would the same effect. It would have the same effect on your lungs, because it's not particular to one type of smoke. It's the actual smoke that damages your lungs. I hope you understand what I'm saying. All right. So I have some slides here showing you what marijuana does to your lungs and what regular cigarette smoking does to your lungs. All right. So it's not just cigarette smoke. A lot of Jamaicans, and let me just instruct you why I started to do these videos, especially why I wanted to tackle this topic today. I see a lot of people on Facebook, on social media, asking about if anybody who smoke weed dead from coronavirus yet. We don't know, all right? That data is not available to me. But what I do know is that smoking, based on the evidence that's there, smoking is definitely a risk factor for complications from the disease. So if you look at the lungs caused by marijuana, the smoking of marijuana, you'll see it's no different. The one in the green is marijuana, the one the pink is tobacco. And there is really no difference. The smoking, and also even smog, if you were in one of those countries that are heavily polluted, the smog causes the same effect. All right? So it damages the lungs' ability to clean and repair itself, all right, themselves, okay? So cancer-causing agents that you inhale, the lungs can't get rid of them, all right? And because the cilia, what it does, it paralyzes the cilia. And the mucus lining, it can't, because the mucus lining is damaged, you can't clear your lungs as you should be able to, all right? So smoking damages the alveoli, and the alveoli are those small little airbags in the lungs that store the oxygen. All right? So when you fill that up with smoke, you displace oxygen. I hope you understand what I'm saying. Smoking displaces oxygen. All right? So that's what it boils down to. All right. So bear in mind now that when you inhale smoke, just think about what happens when you're in a burning building. I don't know if any of you have been in a burning building, whatever. I'm just saying, think about what happens when people are in a burning building. Some people die from smoke inhalation, right? That's simply because the smoke displaces the oxygen in the lungs, and it contains a lot of irritants that poison the lung tissues. You understand what I'm saying? So basically, when you are in a burning building and you inhale the smoke, that is like 100 times worse than smoking everything at once. The bottom line, though, is inhaling smoke constantly over time does the same damage as if you were in a burning building inhaling the smoke and basically dying from smoke inhalation, right? When people go to the hospital, for instance, after inhaling all of this toxic smoke from a burning building, they put them on oxygen. Sometimes they have to ventilate them because they have to try and help the lungs to get rid of the smoke and replace it with oxygen. Because when you have the smoke and you can't get oxygen, the body needs oxygen to function. So smoking displaces oxygen. All right? So let's look at what a smoker's lungs look like now. Let me go down and show you. All right, this is what the smoker's lungs look like. The one on the left is the smoker's lungs over time. The one on the right is actually a regular lung. All right? That's how the lung's supposed to look nice and pink and healthy. When you smoke, your lungs gray and have this ashy color, right? Like it did long time, right? Because what you do, you basically kill the healthy cells in your lungs. All right? So what we want, we don't want this at all. And let me bear in mind that when you stop smoking, your lungs start to heal immediately. And as I cannot stress enough that this is not just from cigarette smoke. This is from smoking everything. Smoking marijuana, because it's not what you smoke, it's the smoke itself, right? We are trying to dispel the rumor that smoking weed in a case like this where coronavirus is concerned basically is any healthier than smoking cigarettes. Where the smoke, marijuana might have different benefits when taken in other ways, but when you have to basically examine the cost to benefit ratio where smoking marijuana is concerned. Because the thing is, you can take marijuana in other ways without the smoke, because the smoke is really what the problem is. You understand? So I'm not against marijuana, I'm against marijuana smoking. All right? Now, I lose my train of thought. So in terms of the ACE2 receptor cells, the ACE2 receptors on the cells, the pneumocyte cells, and I hope I'm not too technical for you, but the ACE2 are also damaged by smoking. Remember now, the ACE2 is what attaches the COVID, the SARS-CoV-2 attaches to. So the virus attaches to the receptors in the lungs, all right? Now, those receptors are also damaged by smoking, right? So the body should be fighting, but it can't fight, right? Smoking also suppresses the immune response of the lungs. You understand what I'm saying? So when you smoke, what is supposed to happen naturally to eliminate all of the toxins, it doesn't work properly. You understand? So make we reason this out now. If you are smoking and you get disease and your lungs are already damaged, what is going to happen to you? First of all, let me go further in telling you what the disease actually does to your lungs. People need to understand this. The disease literally eats your lungs out. It causes the lung tissue to harden. It causes pneumonia, right? It causes also another condition called acute respiratory distress syndrome, ARDS. It causes over time, it causes permanent lung damage. So if you smoke, you already permanently damage your lungs. But the disease, COVID-19, also damages your lungs. It causes hardening of the lung tissues, and as a matter of fact, sorry I didn't actually put up the image of the lungs with the holes in it. They've done autopsies on some of the people who have died from it, and there are holes in the lungs. It's basically the same thing that happened with the original SARS. Remember SARS from 2000, the original one, which was also a coronavirus, a different coronavirus, but still a coronavirus. It had a higher death rate, but basically people had permanent lung damage from that disease, and they're finding the same thing in this disease. All right? Now, if you damage your lungs from cigarette smoking and you end up with this disease, you've just caused complications. And not cigarette smoking alone, smoking on a whole, the smoking. All right? So it means that your lungs cannot, you already have less oxygen coming in. Because when you develop pneumonia, basically you get inflammation of those same little air sacs in the lungs called the alveoli, right? You get fluid buildup in them because the inflammatory response of your body is that it's going to try and fight the disease, right? So it causes inflammation. Inflammation, it causes a fluid buildup, right? So the fluid displaces where air is supposed to go in the lungs. You know, so basically fluid not supposed to be in your lungs, right? So when your body develops this inflammatory response now, you're basically getting fluid accumulating in the little spaces in your lung. We call that interstitial pneumonia. All right, because pneumonia, by definition, is the accumulation of consolidates or fluid in your lung. Your lungs are not supposed to have no fluid in it. Your lungs is supposed to have air in it, are supposed to have air in it. So when fluid builds up in your lungs, you displace where the air is supposed to go. You have difficulty breathing. If you smoke, you already have smoke displacing. Smoke is always in your lungs. You already have smoke displacing where the oxygen is supposed to go. The body's natural risk, basically, your body is supposed to be clearing this fluid from your lungs through the cilia, the same cilia we were talking about. You're supposed to be able to cough up the fluid and spit it out. Your body trying to get rid of it, but you have paralyzed your cilia from the smoking. You understand? And if you paralyze the cilia from the smoking, your cilia can't move up the mucus to come out of your lungs. All right? So you've basically, by smoking, killed your lungs' chance of recovering from COVID-19. So basically, that is how COVID-19 kills smokers. I hope you understand what I'm saying. Can you please save this live, Kamala? Listen, Shay, I don't normally go live, and this is from Instagram. I don't normally go live on Instagram. Somebody asked me, why is it that you don't go live on Instagram? I don't, because Instagram, I can't go live on my computer with the same thing. So I'm going to try, all right? I'm going to try to save it. Just bear with me. If it don't work out properly, I will find a way to upload it. And you can always check over by my Facebook and my YouTube, because I am actually live on Facebook and YouTube simultaneously, and you can actually see the slides properly over there. All right? So let me see if we have any questions on. All right, so Shanafi is saying, but it's not the smoking itself and not the nicotine. All right? The pollutants put people at risk. Yes, the pollutants also put people at risk, but smoking itself paralyzes. Just think about, as I said, just think about the smoke inhalation that we were talking about. The pollutants are one thing, yes, but also, Shanafi, not just the pollutants, the actual smoke itself. The smoke itself paralyzes your cilia, so it can't do what it's supposed to do. All right? And it displaces, the smoke displaces the oxygen. All right? I'm all right. I soon read the comments. I'm not seeing the comments clearly, especially on YouTube. YouTube don't feel anyway. Something is happening. I see that you're watching, but something is happening with my computer with the YouTube comments. I cannot see the YouTube comments. I know you're there. Blessings. I'll read the comments and respond to you individually afterwards. All right. But may I try, because as I said, normally I use my phone, but today somebody asked me to go on IG live as well. All right, because I have quite a bit of followers over there on IG as well. So I will definitely go through and respond to the questions. But really and truly, this is a learning series. I might not be able to do it every day, but as soon as when I can, like the days that I don't go live with other things, I'm definitely going to talk about COVID-19. You understand? And what we can expect. So today, really, the focus is on quitting smoking. All right, we have a lot of smokers in Jamaica, a lot of young Jamaican men. If you should look inside them lungs, x-ray them lungs, what you call it now, just examine their lungs. You will see that because of the things that they smoke, their lungs are totally polluted and look like the old people, worse than the old people lungs them. Smoking over time causes conditions like chronic obstructive pulmonary disease, bronchitis. All of these things are basically put you at increased risk for dying from COVID-19. Now in China, it is said that 52.6% of the men in China smoke. And this is why so many Chinese men died from COVID-19, right? Because there is a significant, especially in comparison to the women, because they say hardly any women smoke, but a lot of the men smoke. So this is why so many men died from COVID-19 in China. And if you look at Italy too, probably that's the case. I'm not sure about the Italy stats, but smoking, especially if you have been a chronic smoker over a long period of time, it basically causes chronic obstructive pulmonary disease, which is you can't breathe properly, right? And this is a chronic condition, meaning that you won't get over it. It is it's a condition that you will have to live with. You understand? Obstructive means something is blocking. Pulmonary refers to the lungs, and of course, disease is self-explanatory. So just bear in mind that prolonged smoking causes all of these complications. People think that smoking weed is healthier. Remember that a lot of our men are mixing weed and grabber. Grabber is nicotine. So smoking grabber is the same as smoking a cigarette because it's the same nicotine. All right? So when you mix the marijuana with the nicotine, you're actually making it worse, even worse than if you were smoking one. And another thing we have to speak about is vaping, because people actually think that vaping is healthier. It is not, right? We're seeing a lot of young people ending up with, some serious lung diseases because of this vaping phenomenon. All right? Anything that damages your lungs right now is a risk factor for you developing complications of COVID-19. You know, I spoke to a young man yesterday in Italy, a Jamaican. I was on Unstoppable's program last night. And a lot of you, if you don't follow Unstoppable on YouTube, I implore you to follow him, Unstoppable Live, Unstoppable TV. And, you know, we were talking to a young man, a Jamaican 35-year-old male, healthy, has no complications or anything, no comorbidities, but him smoke, right? Him smoke, he's a smoker. And he was telling me about this. He now has COVID-19 disease. So yes, we do have a Jamaican right now in Italy who is suffering from COVID-19, and I had the pleasure of speaking to him last night to hear firsthand his account with basically what is happening with him. And he says basically he's of course isolated. He knows how he contracted it. He said basically he was not careful because him believe all of the hype that black people can't get it, that is a conspiracy. He never take it seriously, and he contracted it. What him say he's going through right now, he would not wish on his worst enemy. Him say right now, him feel like an elephant is constantly sitting in his chest and him just can't breathe. I'm describing to you word for word what he told me. Him say it's like an elephant sitting in his chest and him cannot breathe. Every time him take a deep breath, him feel like piece of him lungs collapsing. Right? Him say he has no energy to do anything, but him afraid to go sleep. His fever has gotten as high as 105 degrees Fahrenheit. Right? Him say if him close him eyes, him don't want, it's like him feel like him going suffocating in sleep because he has to make a conscious effort to breathe. Imagine living like that. Alright? He says basically he is in isolation, self-isolation, because in Italy the hospitals are so full that there is no space to admit him. So what the authorities have done, they have sent a ventilator, they've sent all his machines, they check on him through telemedicine daily, they make him read him temperature, they basically go through everything, and if they realize by checking him twice a day that he's getting into the situation where he needs constant monitoring, an ambulance will come for him, pick him up and carry him for ICU admission. But right now, him have to be nebulized, him have to go on, you have CPAP machine, him have to go on the CPAP. They sent all of those things to him. Just think about this. Can Jamaica afford this kind of care? First of all, we don't have these machines readily available to send to people's yard. All right, so we have to think about these things. When he explained this thing to me and what he's going through, my blood start run cold. Because I'm saying to myself that we have so many Jamaicans who have all of these complications. And tomorrow, we are going to discuss why hypertensives are also at risk. So today we're discussing why smokers are at increased risk. Tomorrow we are going to discuss why hypertensives are at risk as well. All right? Now, the thing about it, a lot of people are hypertensive and don't even know that they're hypertensive. So what I would suggest that everybody do right now, go and get yourself checked out. And you don't have to go to a doctor. Some of these little places have, you can go and ask them to check your pressure. Pharmacists even. Make them check your pressure, make them check your blood sugar. Now is the time to make sure that you are healthy. And if you smoke, no matter what it is you smoke, now is the time to try and cleanse your lungs of all sorts of contaminants and pollutants and smoke. All right? You need to get rid of all of these things off of your chest right now, because if you don't get them off of your chest right now, you are at increased risk for complications from this thing. And let me tell you something, do not say you cannot get it, because that is what Shane did in Italy. He thought that he could not get it. He hug up people, he shake people's hand, him say it was him work in the tourism industry in Italy, and he hug up the guests them and shake them hand and all of them things. He did not take the precautions. And that is how he caught it. All right? Because remember, every time I come live, I am going to remind you that people remain without symptoms for up to 14 days with this disease. You understand? People remain asymptomatic for up to 14 days with this disease. Jesus. Somebody just cut off my live on Instagram. Sorry about that. Somebody is calling me and on Instagram, on Facebook said pause the video. Sorry about that, IG. All right, so just to recap, remember that you don't have to know you have the disease to have it. Right? That lady who came patient, they say she's patient one now, she didn't know she had it. All right? So you can get it. Never say never. And when I put up these videos, it's not to make you panic. It is to make you informed. There is nothing I hate like when people think that I'm trying to cause alarm. I'm not trying to cause alarm. I'm trying to educate you so you know what to expect. All right? So today's video, remember, we're focusing on, and I'm not going to stay longer because it's 10:30 now. When I did say half an hour and I have to go to work, it's a Tuesday. I have to go to my office today. I work at a medical center and I'll be taking all my precautions. I'll be sanitizing myself. I'll be sanitizing my patients before they see me. And I will be educating my patients who come to me, to my office, about what to do as well. Once they're on my bed, I will be informing them and educating them. I'll be informing them and educating them. Anytime when I see the video pause, IG is somebody calling me. All right, so yeah. So we're gonna end it here. I will try to save this video to IG, but if it don't save, just remember that you can catch it over on YouTube, and it's also on Facebook. And for you on IG, it's Kamla the Right Mango, both on YouTube and Facebook. And Facebook and YouTube, thank you as usual for your support. I really appreciate it, even though I couldn't read your comments as much, especially YouTube. I don't know what is happening, why the comments are not coming up. I see you watching, but I can't see the comments. Just know it's love and blessing same way. As I said, join tomorrow at the same time, 10 o'clock. We're going to talk about why you need to take extra precautions if you are hypertensive, and why you need to make sure that you're monitoring your video. So I hope this was educational for you. Mommy, I soon call you back. I hope this was educational for you. All right, so take care of yourself. All right, so that's it. Love and blessings, everybody. Share the story. I figured it out. Yes, Mommy. No, it's too early, Mommy. I'm going now.
Look here. Yesterday when Dr. Lisa was talking